Hi, we are here in Boulder, Colorado. I just arrived up here and I've been so lucky that my osteopath has flown over from Denmark to make sure that my body is 100% firing for the next races and for the next hard training block. And I've been working with Claudio for 7 years now, and he's absolutely my #1 go-to source if there's something wrong with me. He makes sure that he fixes me and get me back on track again. So thank you for coming.
Thank you very much to be here.
I just want to shoot some quick questions over so that we can get an understanding of what an osteopath actually is and how osteopaths are working if you get athletes in with injuries or persistent injuries. So can you just explain short what an osteopath is?
So actually, if we start from the principle that any part of the body works correctly if the nervous system and the blood circulation is correct. So an osteopath is like a mechanic. He tries to correct and put in the right place all the structure to make the flow of the blood circulation and to release the pressure on the nerve so the body can heal itself. So an osteopath see the whole body and from a bone structural point of view, ligament, muscular, tendon, organ, and all the connected tissue, so it's able to treat the whole part and the whole body actually.
Okay, so let's make a practical example. Let's say I'm a triathlete that has a problem with my right shoulder and I feel it quite a lot when I'm riding, when I'm lying in my aero bars, and when I'm swimming. It doesn't seem to go away, and I've tried a lot of things. How would you approach this? What would you do if I came into your clinic and told you this?
Good. I will start to ask you a couple more questions, like when do you sleep? Do you have problem with the shoulder? Does it give you pain? Does it?
Yeah, I can't sleep on that shoulder.
Good. So we have actually a mechanical problem. Anytime the shoulder has some mechanical stress, either you sleep on it or you move it or you use it, he has some problem. So there is a kind of malfunction in the joint. So now it's me as an osteopath, as a mechanic, to find out why that shoulder and not the other one is not working.
Yeah.
So I have to find out what is the reason why. So before to start searching on your body and testing your body, it's also important to see the level of irritation, inflammation or damage the shoulder can have, because it can be traumatic, you've been falling,
yeah,
or this is a question you have to get an answer before really start and hands-on patient approach.
yeah.
That means I'm interested to understand, did you have any trauma on the shoulder? After the trauma you start to have pain, or it just come little?
Yeah, it's just come gradually. I think kind of overused. I don't know if I've been sitting wrong on the bike.
Good. So it's a malfunction which comes gradually. So it's kind of malfunction. It's kind of, we start to think we have to already don't think about traumatic effect, not injury, but something you develop.
Yeah.
So it's something in the correct function of the joint, So it's also important to understand the location of the pain.
Yeah.
What is exactly the location of the pain? Because this is in the front, it shows something in the side or in the back. So this is a normal question we have to get through.
Yeah.
And then to not go that deep in details, but it's important to test all the muscle function, the small muscle controlling the coordination of the ombeloscapular joint with the shoulder joint, to see if there is a deep inflammation in it, yeah, and then try to test and find out how exactly that bone, this ombral bone, moves in relation to the shoulder. And I can come up with a different example regarding how can be the different cause of the problem. You can, for example, have a thoracic area, which means the area between the shoulder, which is very tight, and have some gifted tension on the shoulder blade. So that means your shoulder blade, when in the time when you move your arm, it doesn't really follow the motion. So you use too much this joint here. So you start irritating. That can be one of the cause of the problem. Or it can be something coming all the way down to the diaphragm. The diaphragm is tight, so you have a ligament, we call it fascia tension, all the way up to the shoulder. So the shoulder is pulled down. Anytime you use your arm, you irritate the area. Or you can have a nerval problem coming up from the neck, goes into the shoulder. Or you can have problem on your elbow or your wrist, which give a bad information how to move correctly the shoulder. Or the joint itself, it can be unstable because it has been used too much. So we have to analyze the different aspects and find out what is the main reason of the problem.
So basically everything that works on the shoulder, you're thinking, so everything that can be related to the shoulder with the movements that we do all the time.
Right. Basically, what you have to find out, if we have a shoulder problem, you have to start to look at the body back and forth for the diaphragm area up.
Yeah.
You can all find some connection all the way down, but this is very down. It's very few, in my experience anyway. It's in the most problem from the diaphragm up. All the areas will be controlled, and all the nerve and the connection is been checked all the way through, and then find what is the real problem, and then working on it, and fix it.
Yeah. So sometimes, like when I've had a small nickel injury, I've come to you with that. You test the joint before you start working, so you test my strength in. It could be a leg or it could be a shoulder. Why do you do that?
It's to test your functional level, if the nervous system works alright, or how is the inflammation of the area. I can, for instance, test the joints and move, and so I can find the motion if the joints move correct. That's show me if there is some block in the joint, which is fine. There's a mechanical test, very easy. Even a doctor can do it. Not the specific as an osteopath probably, but easy. But then we need to go further on, more specific. We need to test also the area around the joint. If the joint it moves correct but still have problem, why? So we have to test all the little muscle controlling the joint and see if there is inflammation. So while turning in different direction, testing different position of the arm, we show which exactly that area is involved. And then, so we already have a key. You test it, how? That's hurt me. Good. So we know that's something wrong right there. So as soon as we remove the cause, that test will be negative again. So what we have to do is say, okay, we got that, we know which kind of structure, I know which kind of structure is related to. And then when it fixes, then I retest it again.
Exactly.
And then you have cleaned the test, and then the patient, you as well, you will feel like, wow,
that was crazy. Wow, normal strength again.
Good. Which is this is actually it's a test. It's like testing your body. It's like testing any kind of mechanical structure. This way doesn't work. This way it works. Okay, let's give you pain. Let's remove this problem. Let's get rid of this block and test it again. Wow, now it works much better. Doesn't feel any pain. This means you will be able to do what you need to do.
Yes. So if we take myself as an example, I don't have any injuries. I don't have any niggles. I actually feel very fine. But still, I have invited or asked if Claudio would come over to me and give me some treatments and kind of help me further on for the season. So what can you do for me when I'm actually fine?
It's actually different working plan on a patient, and in respect of what is the patient need. If it's a normal, if it's a high sport athlete like you, and what is important, if you have an injury, if you have an acute pain, the treatment has a one direction. Now, what is best work at? Having a patient correct and keep the body as perfect as possible. To try to put, to see the small difference which are present the time being in the body and make them work better. So in the way we are actually, it's like why do I brush my teeth every day? Mm-hmm. I know if I don't keep it clear, if I don't keep it clean, that will have problem in the future. Why do I check my car once in a while? Mm-hmm. And if my car is a racing car, I will have to check much more. And it's like your body. You have to be checked. Your body has to be structurally. You use your body that much, yeah. And it's important that all the level is correct. You can check yourself correct. You can see if the body starts to twist a little bit on the pelvis, your leg is putting an external rotation, your head is shifting on one side. This is my clinical eye saying, okay, that's just a bit center, because as soon as you go out from your centrum, you start to have a problem. Yes, you start to stress a little more your body. It's not really giving pain at that time, but you start to losing some energy. Yeah. And also in your performance will be reduced. So what is important for me to avoid your future problem and pain, is important to keep your body as much as possible straight on line.
To have all the energy you need for training and racing, basically.
Yeah. And to work perfect.
Yeah, so you talk about the body being in balance and alignment, and that is kind of what we want to achieve for prevention of injuries. Does that go for everybody, all athletes, all human beings?
Of course it does. It's like, I will show you on my body in a practical example. Try to see if my posture will change and goes like this. How will my shoulder, in relation to the shoulder bone we talked before, how will my shoulder blade, it will be bent in front, so my range of motion will be reduced. So actually, if my shoulder doesn't move correct, so I will start to stress the other joint. How, for example, how will my organs will doing fine in this position, for example?
Yeah,
I don't think
not
so.
Really.
It's like, can I be happy if I do like this? No, really not. It's like the posture has to be. It's very important. It's important that you're centered both on frontal plane and a sagittal plane.
So you believe that if you kind of have a bad posture, or if you are sitting much on the computer in the aero bars, that over time you can easily go out of your alignment, like your perfect balance.
It's not a belief, it's actually a fact.
Okay,
it's like if a car has a wheel which is not in the right position, does the car can drive straight? Yeah. It can't. So it's the same with the body. If your legs turn one side, can the pelvis be straight on line? Yeah. No. And if the pelvis is out of balance, can your spine have a good fundamental base to develop correct? Yeah. No. And then you can start to develop some problem. It's very important. We are very mechanical, it's called actually biomechanic. As much as we can be on line, straight and work correct, with no tension, with the good elasticity, it will work fine. Yeah.
And we will stay more healthy if we kind of get checked once in a while, like maybe every second, third month, just to check if everything is good.
It will be perfect.
Yeah, and you can kind of avoid a lot of small niggles and maybe even injuries. Yeah. I guess that was it for now. Thank you so much for coming over. It has been amazing again, even though it's a few days, but we don't really need much. Now you need to get back to Denmark and treat all the rest of the patients that you have that need you as well. Thank you.
Thank you very much for being here.